Hello, a warm welcome to you from SGT University. I'm Dr. Vinika Chaudhary from Faculty of Physiotherapy. Today, we will be learning about the spinal cord. Spinal cord, it is an important structure of the central nervous system as it connects the brain to the body. Spinal cord is the most important structure between the body and the brain. The spinal cord is 40 to 50 cm long and 1 to 1.5 cm in diameter. It is firm, cord-like structure and extends from the foramen magnum, where it is continuous with medulla, to the level of lower border of first lumbar vertebrae. It terminates at the conus medullaris. Phylum terminale extends from conus medullaris to the coccyx, and below that it continues as chorda equina. The spinal cord is a cylindrical structure of nervous tissue composed of white and grey matter and is uniformly organized and divided into four regions: the cervical, thoracic, lumbar, and sacral region. Two consecutive rows of nerve roots emerge on each of its sides. These nerve roots join distally to form 31 pairs of spinal nerves. Although spinal cord constitute only 2% of the central nervous system, but the functions are vital. Here I enlist few of the functions of the spinal cord. The three major functions of spinal cord are the conduction of motor information traveling down the spinal cord, the conduction of sensory information in the reverse direction, and acting as a center of conducting certain reflexes. Knowledge of spinal cord functional anatomy make it possible to diagnose the nature and location of cord damage and many cord diseases. The spinal cord is being divided into four different regions: the cervical, the thoracic, the lumbar, and the sacral regions. These cord regions, they can be visually distinguished from each other. Now we will have a look on the segmental and longitudinal sections of the spinal cord. In the longitudinal organization, the spinal cord is divided into four different regions: the cervical, thoracic, lumbar, and the sacral regions. There are two enlargements of the spinal cord which can be visualized: the cervical enlargement and the lumbar enlargement. The cervical enlargement which extend between C3 to T2 and the lumbar enlargement which extend between L1 to S3. The surface of spinal cord shows several longitudinal grooves. Anteriorly, the deep anterior fissure, posteriorly, shallow posterior median sulcus, and on the lateral aspect, two sulci, that is anterior lateral and posterior lateral sulcus. From the lateral sulci, a series of root filaments emerges anteriorly and posteriorly on each side. Several filaments from anterior lateral and posterior lateral sulcus unite to form ventral and dorsal roots respectively. The dorsal and ventral roots are paired. They join distally to the dorsal root ganglion and form the spinal nerve. The cord is segmentally organized. There are 31 segments defined by the 31 pairs of nerves existing in the cord. These nerves are divided into 8 cervical, 12 thoracic, 5 lumbar, 5 sacral, and 1 coccygeal nerve. Dorsal and ventral roots enter and leave the vertebral column respectively through intervertebral foramen at the vertebral segments corresponding to the spinal segment. In the transverse section of an adult spinal cord, we see the white matter at the periphery and grey matter is inside, along with a tiny central canal filled with CSF at its center. Now we will have more closer look onto the internal structure of the spinal cord. In the transverse section of an adult spinal cord, the grey matter is inside and the white matter is at the periphery. Grey matter is a region containing cell body and its shape is like letter H or butterfly shape. The two wings of butterfly are connected across the midline by the dorsal grey commissure and below the white commissures. The shape and size of grey matter varies according to the spinal cord level. At the lower levels, the ratio between grey matter and white matter is greater than in the higher levels, mainly because lower levels contain less ascending and descending nerve fibers. Grey matter is divided into various nuclei and lamina. The prominent nuclear group of cell columns within the spinal cord from dorsal to ventral are the marginal zone, substantia gelatinosa, nucleus proprius, dorsal nucleus of Clark, intermediolateral nucleus, lower motor neuron nuclei. The distributions of cells and fibers within the grey matter of the spinal cord exhibit a pattern of lamination. This is also called as Rixed lamina, Rixed to propose a new classification based on 10 layers. The lamina 1 to 4 are concerned with exteroceptive sensation. Lamina 5th and 6th are concerned primarily with the proprioceptive sensations. Lamina 7 act as a relay between muscle spindle to midbrain and cerebellum. Lamina 8 and 9 is responsible for the axons of the neurons. In the lamina 8 and 9, the axons of these neurons innervate mainly the skeletal muscle. Lamina 10 surrounds the central canal and contains neuroglial cells. White matter. The white matter, which consists of longitudinal bundles of nerve fiber, is divided into 3 columns on each side. These columns are anterior column, lateral column, and posterior column. Anterior column contains ascending and crossed fibers in the ventral spinothalamic tracts, along with the descending fibers in the olivospinal, vestibulospinal, tectospinal, and ventral corticospinal tracts. The lateral column, it contains the major descending motor pathways, lateral corticospinal tract with the smaller descending rubrospinal tract and ascending and crossed spinothalamic tract. Dorsal column, it contains the uncrossed gracile and cuneate fascicles. The arrangement of fibers in various columns. In the posterior column, as they do not cross at the entry point in the spinal cord segment, the fibers from the lower limb are placed more medially near the central canal. The fibers from the upper limb are placed more laterally. Median to lateral at the cervical level, there are sacral, then lumbar, followed by thoracic and cervical. In the lateral and anterior column, the fibers they cross in the spinal cord. The lower limb fibers are placed more laterally, and the upper limb fibers are placed more medially at the cervical level. From medial to lateral, they are cervical, thoracic, lumbar, and sacral. The blood supply of vertebral canal is critical, especially from the context of surgical and clinical consideration. So we'll discuss about the blood supply in detail now. Spinal cord receives its blood supply through 4 types of arteries: the anterior spinal artery, the posterior spinal artery, the segmental spinal arteries, and the feeder arteries. There are 2 posterior spinal arteries, each derived from the corresponding vertebral or posterior inferior cerebellar artery. These 2 vessels traverse the length of spinal cord, lying just in front of or just behind the dorsal nerve roots. There is a single anterior spinal artery formed by the union of a branch from each vertebral artery, which descends through the length of the spinal cord in the anterior median fissure. The arterial blood supply to the spinal cord in the upper cervical region is derived from 2 branches of the vertebral artery, the anterior spinal artery and the posterior spinal arteries. These travel in the subarachnoid space and send branches to the spinal cord. The spinal arteries are reinforced at each intervertebral foramen by the segmental arteries derived from the vertebral, costocervical trunk, intercostal and lumbar arteries. At the spinal cord regions below upper cervical levels, The anterior and the posterior spinal arteries narrow and form an anastomosic network with the radicular arteries. The posterior spinal arteries are paired and form an anastomotic chain over the posterior aspect of the spinal cord. A plexus of small arteries, the arterial vasocorna, on the surface of the cord constitute an anastomotic connection between the anterior and posterior spinal arteries. This arrangement provides uninterrupted blood supply along the entire length of the spinal cord. Feeder artery, or the artery of Adam Kivis. It is the largest anterior segmental medullary artery. The artery is named after the Albert Adam Kivis. It typically arises from the left posterior intercostal artery, which branches from the aorta at the level of T9 and L2 and supplies the lumbar enlargement. It is also known as Great Radicular Artery of Adam Kivis. The applied anatomy. The primary blood supply to the spinal cord is interrupted, causing ischemia or infarction to the spinal cord can lead to two different syndromes: the anterior spinal artery syndrome, the posterior cord syndrome. Spinal veins derived from the spinal cord substance terminate in a plexus in the pia mater, where there are 6 tortuous, often plexiform longitudinal channels, one along the anterior median fissure, second along the posterior median sulcus, 2 situated on the right side, one pair just behind and other just in front of the ventral and dorsal nerve roots. These 6 vessels communicate freely with one another and above pass into the corresponding vein of the medulla oblongata and drain into the intracranial venous sinuses. The posterior half of the cord is drained by the posterior medullary veins, and anterior medullary group has 1 lateral and 2 medial groups. The Batsons Plexus. The azygous system is a large network of veins draining blood from the intestine and other abdominal organs back to the heart. The segmental veins drain into the azygous vein located on the right side of the abdomen, or into the hemiazygous vein located on the left side. The azygous system also communicates with the valveless venous network known as Batsons Plexus. When the vena cava is partially or totally occluded, Batsons Plexus provide an alternate route for the blood returning to the heart. So today we have covered about the internal structures of the spinal cord and the blood supply. In the next lecture, we will be learning about the different ascending and descending tracts of the spinal cord. Till then, keep learning, keep growing. See you next time.